Apollo Hospital Spectra. Thank you, Mr. Scott, for joining us, and a pleasure to have you with us.
Thank
And
you for having me.
heartiest congratulations for
Thank
Rosanne.
you. Thank you.
So you have a rich legacy about 4 decades, and Dr. Reddy has done a remarkable work at Med. So talk to us. What is the USP of Apollo Spectra?
So Apollo Spectra, as I mentioned, it actually started as a concept around a decade ago. Apollo is of course synonymous with high-end tertiary care. We do a lot of complex, high acuity surgeries. But the concept was born because Dr. Pratap Reddy and also our joint managing director, Dr. Sangeeta Reddy, they understood that still there is a lot of care which is needed on a day-to-day basis, where the patient may not actually want to go for to a very complex environment. For example, something that we have seen is birthing. Now, to give a birth, earlier people used to go to hospitals, but most of the birthing has now moved out of a complex environment. So similarly, we are seeing that a lot of these simple daycare procedures, which do not need to be necessarily mixed with the cancers, the very complex neurological problems, they are sort of moving out of those complex settings and moving into the settings such as Apollo Spectra, where we are providing the same high impact technology, but we are providing an environment which is much more friendly. It's very easy to navigate, and it's very close to the neighborhood. As I mentioned, we have a huge network now. We are present across 22 locations. So the future is bright. We are investing more in infra. We are adding more hospitals. We will continue to invest in technology as we move forward.
Super. Can you throw some light on the affordability piece of it?
For the robotics,
Yes.
so robotics, it's definitely evolving. If you talk about perhaps a cost with respect to the conventional surgery, perhaps it will be a marginal. There will be a marginal difference, but we are seeing that delta come down. As we are moving forward, and the good thing is that now a lot of insurance companies are also covering for the robotics. If the patient wants to go for reimbursement, then it's pretty much covered in 100% of the cases. But in case of cashless, we are seeing more and more insurance companies covering for it. And I think probably in a year or two, it will be like any other conventional surgery. I think probably everything will be robotic assisted, at least in the field of orthopedics.
Okay. Why robotics? Can you give a comparison between robotics and conventional?
So robotics, as was explained by Dr. Pandey and by Dr. Nadvi, it's again the same surgeon who's performing the surgery, but they just have assistants that they are able to customize the surgery as per the unique needs of that particular patient. So they provide the inputs based on the patient, and it tells them how much to cut, how deep to cut, and all that. So the surgery is much more precise, and the 20% of the cases that Dr. Alok Pandey and Dr. Nadvi mentioned do that. Probably 20% of the surgeries, the results may not be as optimal as they would like. At least that number will come down, because we will be able to do surgeries which will be much more precise, much more correct, and then the percent of cases in which a redo has to be done, that will come down with the help of with the help of
What
robots.
is the success rate?
The success rate is again same surgeon doing the surgery. The success rate is similar, if not a little higher than a conventional surgery. I think it's more than the success rate. It's the precision. The precision is definitely much higher than a conventional surgery, and from that perspective, the surgeons love it because they know they have this tool available at their disposal, where they can customize as per the every individual patient needs and give a result which will be very specific to that patient, which otherwise cannot be done in a conventional surgery.
Okay. Apart from Spectra, what are the other formats you have in Apollo?
So Apollo Spectra is a part of Apollo Health and Lifestyle, which is a subsidiary of main Apollo. There are various formats that we have. We have, apart from Apollo Spectra, we have Apollo Cradle, we have Apollo Dialysis, Apollo Diagnostics, Dental Clinics. So all the retail formats where we are trying to take the care closer to the patient.
Okay.
They fall under this umbrella of Apollo Health and Lifestyle.
Sure. What next after Rosa?
What next? We remain committed. We are going to continue to invest in technology. In fact, we are planning to get two new robots in Delhi next. We
Okay.
have two new centers in Delhi, which recently we had a launch for. So we are planning to bring robotics there. We'll continue, as I said, more centers. Probably we'll look at expanding through associations. We'll continue to invest in infra. We'll continue to invest in technology because I think there is so much more which can be done to provide help to the people at large.
All right. It's so wonderful to see women at the helm of things. So, what would you like to say to the women, your final words for the women who are aspiring to be in medical fraternity?
So more power, more power. Yes, we definitely. I think we need more of us.
That's good.
I agree. We definitely, I think, need more of us. But I think if I look at it from that perspective, Apollo is quite unique because we have Dr. Reddy, and then we have
Dr.
Dr.
Sangeeta.
Sangeeta, Dr. Preeta Reddy. So we have the four sisters. So it's good to have women leadership at the realm of the things, and definitely then that sort of comes down to the organization. But stay put is what I say.
Yes,
Stay put,
absolutely.
continue, don't give up, and I think women are in all phases of life. Women are doing a really phenomenal job.
That's right. So true. I've spent a good number of years in Hyderabad. I know Hyderabad is synonymous to Apollo.
Yeah, yeah.
So keep up the legacy. Wish you good luck. Thank you. It's a
Thank you
pleasure
so very
talking
much.
to you.
Thank
Thank you
you.
so much.